A 2-month-old infant suddenly begins to refuse formula milk, even after switching to a different brand. Despite efforts to offer alternatives, the baby consistently rejects the bottle and shows a clear preference for breastfeeding. This unexpected change can be concerning for parents, especially if the child had previously accepted formula without issue. Such behavior may raise questions about the baby's health, comfort, or possible sensitivities. Understanding the reasons behind this shift is important for ensuring the infant receives adequate nutrition. It is not uncommon for young babies to develop strong preferences, and various factors can influence their feeding choices at this age. There are several common reasons why infants may change their feeding habits. As babies grow, their psychological and physiological development can influence how often and how much they want to feed. Changes in their environment, such as moving to a new home or alterations in daily routines, can also affect their sense of comfort and security during feeding times. Additionally, an infant's feeling of safety while breastfeeding plays a crucial role. If a baby feels unsettled or distracted, they may nurse less frequently or for shorter periods. Understanding these factors can help caregivers respond more effectively to their baby's changing needs. Breast milk and formula milk differ in several important ways. Breast milk naturally contains the ideal balance of nutrients, antibodies, and enzymes tailored to a baby's needs, supporting both growth and immune system development. In contrast, formula milk is manufactured to mimic the nutritional profile of breast milk, but it cannot fully replicate its unique bioactive components. During certain stages of development, infants may prefer breastfeeding because it provides not only nutrition, but also comfort and bonding with the mother. Additionally, the composition of breast milk changes over time to meet the evolving needs of the growing child. These factors can make breastfeeding particularly appealing to infants at specific points in their early life. Several factors can influence a child's refusal to drink formula milk. The taste and smell of the formula are often significant, as some children may be sensitive to unfamiliar flavors or scents. The temperature of the milk also plays a role. Milk that is too hot or too cold may be unappealing. Additionally, the method of feeding, such as the type of bottle or nipple used, can affect a child's willingness to drink. Understanding these elements can help caregivers identify and address the reasons behind a child's reluctance, making feeding a more comfortable experience for both the child and the parent. Experts recommend that when a baby only wants to breastfeed, parents should closely monitor the child's health and development. It is important to regularly check the baby's weight and growth milestones to ensure they are progressing appropriately for their age. Parents should also observe for signs such as adequate urine output, alertness, and satisfaction after feeding. If the baby appears to be thriving and meeting developmental markers, exclusive breastfeeding may be suitable. However, if there are concerns about weight gain or developmental delays, consulting a healthcare professional is advised. Early intervention can help address any underlying issues and ensure the baby receives proper nutrition. It is important for parents to remain patient when introducing formula milk to their child. Sometimes, a baby may initially refuse a new formula, but this does not mean they will always reject it. Waiting a few days and trying again can often lead to better acceptance. Creating a calm and comfortable environment during feeding times can also make a significant difference. Gentle encouragement and a relaxed atmosphere help the baby feel secure, making it easier for them to adapt to new feeding routines. Remember, every child is different, and finding the right approach may take some time. Listening to the needs of children is essential for their overall well-being. By understanding what they require, parents and caregivers can provide the right support and guidance. Ensuring that children receive adequate nutrition is equally important, as it directly influences their growth and development. A balanced diet helps build strong bodies and sharp minds, laying the foundation for a healthy future. Combining attentive care with proper nourishment allows children to thrive both physically and emotionally. Ultimately, these efforts contribute to raising confident, resilient, and happy individuals.